Okay, take it away, Jackie.
Well, I just want to say welcome to our guest today. This is our webinar on future-proofing your retirement. And we just want to say a special thank you for attending, and hopefully you guys will get some value out of this today. Now, we are recording this webinar, so you're welcome to turn your camera off if you don't want to be in the recording. And also, we're going to be going through about a 30-minute presentation. And then after that, we're going to have time for questions. So please feel free to save your questions for the end, and we'll be happy to answer them for you then. So once again, thank you for attending the Future Proof webinar. Our purpose and our goal is to be a resource group to the community so that people are prepared for a successful and crisis-proof retirement and late life. So we want to start planning now with you. We are a certified financial educator. We have a health insurance broker, a senior living advisor, and a guest speaker today on forever home planning. And our vision is really to bring up those questions that you wouldn't normally think about so we can help you prepare before the crisis hits. It's always better to have a plan before you're in crisis mode. And I want to introduce you to the Future Proof team. So we have our founding members, Alicia Mack, who's a senior living advisor with Oasis Senior Advisors, Joy McMurtry, our certified financial educator. My name's Jackie Walter. I'm a health insurance advisor with Translating Insurance. And our guest speaker today is Donna Austin, who's a senior real estate specialist with eXp Realty LLC. And Joy is going to start off today on our presentation. And Joy, did you want to take over?
Thank you so much, Jackie. Today, I'm going to talk about what you need to finish strong. Next, when talking to a financial professional, it can sometimes feel like you jump into data and products right from the beginning without taking the time to discover not just what you need, but why you need it. And the why, however, is going to be the foundation upon which your entire plan is built. So I really encourage you to find someone who starts there. If you haven't already, this is where my firm always starts. Next. So these are the 7 money milestones that we use to walk each family through the process of reaching their goals and dreams. Each step is essential to get right so that you reach your destination when and where you want to be. Next, let's talk a little bit more about what makes a good plan. First off, it needs to be comprehensive. Are you covered in all areas? Are there gaps that you might not know you have, like a lack of long-term care coverage? But maybe several family members are likely to need it. That was the case with my in-laws. They had no idea that long-term care can cost over $12,000 per month, but they only had about 4 months worth of long-term care funding in their savings account when my father-in-law had a debilitating stroke last year. Because of that, their options were very, very limited when he needed to go into a care facility after he left the hospital. And we want you to have more options than that. The next step is to make sure that it's cohesive. Do all parts of your plan work together? Many times people collect a 401k here, some stock there, maybe a rental property, but how do all of these parts help you reach your goal? Do you have confidence that you will reach your goal with the pieces that you have in place now? We also like to have a plan that is diversified. And today this means so much more than stocks and bonds. Instead, we're talking about different types of money. Do you think that taxes will go up or down? The way things are looking, they're definitely going up. So what happens if all of your money is in taxable accounts? Many people don't realize that PERS is entirely taxable money. The same is true for 401ks and traditional IRAs. So we want to see both taxable and non-taxable money, and you should also have both reliable income and money for bigger expenses like a new roof or a family trip. Most importantly, both partners need to know the plan. Now, this doesn't mean that both of you have to be money nerds. Some of us are more excited about spreadsheets than others, but it does know that each of you need to know where important information is. And I have a couple who are a great example of this. The husband fell suddenly ill, and the wife had never had to pay a bill or write a check in her life. Her husband took care of all of that for her. She had no idea what their income was or where to find their financial accounts. Do both people in your household know everything about your plan and where and how to access important information if there is a crisis? Next. Another important element is the timing of implementing your plan. As you can see, several things need to be put in place long before you will ever need them. Long-term care in particular needs to be addressed early because by the time you're thinking you might need it, sometimes in your 70s or later, many of your options for long-term care will no longer be available since you have to qualify when you are in good health or before the age of 70. My grandmother purchased her long-term care policy in her mid-50s and did not end up using it until she was 92. She felt that it was 100% worth it, though, to have done that early planning so that she could have an easy transition into the next level of care. Another thing that's very important as you're getting closer to retirement is to project your income goals and your expenses. If we have more years like last year where inflation was 7%, you might need to make some adjustments to make sure that you have enough income for the cost of living when you want to retire. And then in the last 5 or 10 years before you want to retire, there might be a few more slight little adjustments that will make sure that you are totally prepared for that next step. Along this entire time, it is important to be reviewing your estate plan every 3 years. And the final thing to put in place before you retire is to establish a final expense plan. You don't want to have something unexpected happen and your family have to come up with $10,000 or more for your final expenses when that's something you could have taken care of ahead of time. Next, let's talk a little bit more about final planning. 54% of adults do not currently have a will or any other type of estate plan. And this can create a huge stressful mess for your family if that happens. A lot of times we think of wills as being something that you only need if you're getting older, but basically anyone over the age of 18 who owns any property at all should have some type of final plan in place. Next. These are the 4 documents that every complete estate plan should include: a will or a trust, a financial power of attorney, an advanced healthcare directive. They're also called a living will in some states, and a HIPAA release form. One other thing that you might need is a pet trust so that your pets have a plan for who's going to be taken care of and maybe even some money to take care of them if you leave first. Next. A few little notes on the difference between a will versus a trust. Again, I'm not an estate planner, I'm not a estate attorney, but I do specialize in estate planning on the financial end of things. For wills, a lot of times it's for a simpler estate, things that don't involve big assets. One of the triggers we often see for someone needing a trust is owning a big piece of property or another big asset, like your house. And some people are concerned about the cost of putting these things in place, but there are even options to have a free will set up where you can make sure your family is taken care of. Next. So one of the most important benefits of working with me and my team is that it is free to work with us, and we will never charge you for advice. We want you to experience top-level financial strategies and have top-level advice that is usually only seen by, I'm sorry, let me start this sentence over. We want top-level financial strategies to be accessible to everyday people like yourself. That was me before I started all this. You also get the benefit of a large team of specialists. We have experts in life insurance, retirement, investments, estate planning, and college planning on our team to help each family build their customized plan. I'll hand it back to you, Jackie.
Thank you so much, Joy. That was great. I'm one of those spreadsheet lovers myself. My name is Jackie Walter. I'm a health insurance advisor with Translating Insurance. And today I just want to talk about some health insurance solutions for the hospital, for your doctors and outpatient coverage, both before and after retirement. So you have a choice in life. Would you rather figure out all these confusing insurance topics on your own? Or would it be more helpful to have someone guide you through these topics at no extra charge? So today we're going to talk about a few things like, what is Medicare? Do I have to enroll? What if I work past the age of 65? Or what if I retire before I'm eligible for Medicare? So we're going to talk about next, what is Medicare? Medicare started in 1965, and it was a federally subsidized health insurance program to provide hospital and outpatient coverage to people in their later years. It is subsidized, but it is not a free program. So there are monthly costs associated with Medicare. It's also compulsory when you're eligible. That means if you delay enrollment, you could be liable for penalties. Medicare is comprised of 4 parts, all of which are different kinds of coverage. So there's A for hospital, B for outpatient, D for drug coverage, and C is something called the Medicare Advantage Plan. Now you are required to have original Medicare Part A, which usually comes at no cost, but Part B does have a monthly premium associated with it that starts at $170.10 a month for 2022. But that could be as high as $578.30 a month, depending on your income. So if you are not aware of what those charges could be when you're getting close to retirement, you could be in for a really unpleasant surprise if you find out that your income puts you in that higher monthly premium bracket. Medicare also does not cover long-term care. It covers short stays in skilled nursing facilities to rehabilitate you, but it doesn't cover those longer term stays, which Alicia will talk about later. And so it's really important to have a plan for long-term care. Now, original Medicare itself, which is Part A and B, comes with large hospital deductibles that are per occurrence. It's not an annual deductible. It also comes with 20% coinsurance for all outpatient services, and there's no max out of pocket with original Medicare. So it's really important to get together with a health insurance broker who can help you to fill those gaps and make sure you don't have that unlimited liability that comes with original Medicare. Who's eligible for Medicare? So right now, people turning 65 are eligible for Medicare. You also need to be a US citizen or a resident for at least 5 consecutive years. There are some special situations where people under 65 can qualify for Medicare based on a disability or end-stage renal disease or Lou Gehrig's disease. Do you have to enroll? Well, I did touch on this earlier. There is a penalty for not having Part B when you first become eligible. That penalty is 10% per year that you go without the coverage or other creditable coverage, which we'll talk about in a minute. That penalty follows you for the rest of your life. So if you wait 10 years to enroll in Medicare, you're going to have 10% times 10 years tacked on to every monthly premium. If you miss your initial enrollment period, your coverage could be delayed for an entire year. I have had clients come to me and say, I didn't enroll in Part B on time, and they did have to wait almost an entire year for any outpatient or preventive coverage. All they had was hospital coverage. What if you decide to work past age 65? This is happening more frequently as people are, healthier later in life and enjoying, continuing what they're doing. Individuals who work for a small employer, that's 20 employees, that's under 20 employees, I apologize, need to enroll in Medicare when they are first eligible. Medicare will be their primary coverage, and their group plan would be secondary if they chose to keep it. If you purchase your insurance through the ACA or you have private insurance, for example, if you own a small business, you would need to enroll in Medicare when you are first eligible. Individuals who work for large employers with 20 or more employees are allowed to delay enrollment in Medicare until they lose that group coverage, because Medicare will be your Medicare would be secondary in that situation and your group plan would be primary. And again, retiring after 65, if you work for a large employer, does give you a special enrollment period to add Medicare later without a penalty. So those people working for large employers would not be penalized. Now, when can you enroll in Medicare? Well, you have your initial enrollment period that starts 3 months before the month of your birthday. It includes the month of your birthday and 3 months after. So there's a 7-month initial enrollment period. If you are currently paying for private insurance or you work for a small employer, that would be the time period you'd want to get your Medicare set up so that you don't face penalties later. There's also a general enrollment period for people who either missed their initial enrollment period or possibly lost Part B coverage for non-payment. They can use that general enrollment period to sign up, but their coverage would not start until July 1st. And then finally, we have those special enrollment periods for people who have qualifying life events, like they have employer-sponsored coverage that they're losing. What if you retire before you're eligible for Medicare? That would be really nice, right? To retire before age 65, you would just be, need to use a broker to find private insurance. You can DIY, you can go on healthcare.gov or try to find it yourself, but a broker will actually help you qualify for advanced premium tax credits to help keep your premiums as low as possible when you're on a fixed retirement income. So there are plans available for pre-existing conditions that limit your financial exposure and give you a max out of pocket. Some people ask, what about COBRA? When I retire, I'll be eligible to keep my group plan by going on COBRA. COBRA is a great option if you're under 65 and you're not eligible for Medicare. It's also a great option if your income is still really high after retirement and you're not eligible for advanced premium tax credits to help reduce your premiums through a private plan. But COBRA does not work well with Medicare. So if you are losing group coverage and you are eligible for COBRA, I highly recommend that you talk to a broker to make sure that you are not going to put yourself into a penalty situation. I would recommend going on Medicare. A lot of this information can feel really overwhelming. I don't want you to feel overwhelmed. My goal is to, make insurance solutions simple to understand, and my help is free, so you don't have to figure it out on your own. If you have any health insurance questions, please give me a call or reach me on my website. And next, we're going to go to Donna Austin, who's going to talk to us about home is a place and a plan. So Donna, take it over. Oh, you're on mute.
Here we go. Okay. I didn't want anyone to hear my little dog snoring. So, so I am a senior real estate specialist. I'm also a principal broker. I've been a realtor for 7 years, and I work with traditional clients, but I also have a specialty working with seniors who are selling their homes. And when I'm working with someone who's selling a home later in life, I really look at the home differently than when I'm working with someone who's selling early on, because the home really takes on more characteristics when someone is moving into retirement. So the home obviously is an asset for most people. The home is the biggest asset that they have, and it has to serve multiple functions. And the home also is where you've lived a chunk of your life and you've created a lot of memories, and a lot of seniors have been in their homes for a long time. And so there are a lot of memories, a lot of things with sentimental value. And part of my job is really honoring all of that and helping seniors figure out how do they take the memories with them and downsize and, still honor their home while they're moving into their next phase of life. And the home is also a legacy. And when there are children involved, maybe the home is serving multiple functions, and part of the home is also the legacy for the family. So what is different about selling a home later in life than it would be if you were, just starting out and selling your first home and transitioning? And really the main thing is that it's more critical to preserve the equity in that home and be able to pull the value out of it, because that money needs to be used for other things and to fund care or retirement. And there really isn't a time to be able to do it over. It's not like you want to just sell the house and buy something and then sell again. Really, it becomes more critical that you're making a good decision about whether it's a good time to sell and what to do with the money from the sale. So, a lot of seniors have been in their home a long time, and then they have to make a decision about when do I sell. And we're not just looking at the market and is it a good time to sell or should I sell in spring? We're looking at when is a good time to sell for my overall retirement plan, for where I'm going to next, and what makes sense in making that transition. So I'm there to help people with that and to coordinate with other professionals and give people the advice and support they need with that. And then I want to help, when I'm doing that, help people celebrate the past they've had in their home and also visualize what their new life can look like, even if it's in a smaller space, or maybe they're living with relatives, and just help create that transition for them. So some people, are moving because they're going to move somewhere else. They're going to buy a home that fits their lifestyle better now that they're in retirement, or they're going to move to a 55 plus community. They might move in with family. And there are all kinds of retirement community options, which Alicia's going to talk a little bit more about. These are just a few: independent living or assisted living, or maybe even memory care. And people are selling so that maybe they're going to buy another home, but maybe they need to take the cash out of that home to finance their next purchase, to finance care, to finance long-term care. And my job is to really help them maximize the gain they're going to get out of their house, so that they can use the money for the purposes they have it set aside for. And maybe part of that's leaving some money to family. And so I work with people at all stages. When I work with younger people, I try to get them to think about, where does this home fit into your overall long-term plan? Would you like this to become a rental and then you'll buy another house? Or if you're buying, you can stay on that slide, that was fine. If you're buying a home when you're pre-retirement and you think maybe I'll stay there 10 years, thinking about how would it be to age in place in this home? Does it have too many stairs? How is the bathroom big enough that I could fit a different kind of tub or whatever? And to be thinking about those things. And so what I do as a senior real estate specialist is bring that set of skills to any point where people are buying or selling a home. But what a senior real estate specialist does is we have special training and skills through the National Association of Realtors to work with people who are selling a home later in life, to help them preserve their equity, to help them manage all the phases of the process, which are more complex than when you're selling earlier in life, to help with things like professional resources to downsizers or movers or caregivers. And while all that's going on, to just really be there to celebrate the person who is transitioning and selling their home that's full of memories. So the takeaways that I'd like people to get from this are just that when someone's selling pre-retirement or in retirement, it's not just about selling a house, it's about the house and the person and the money and the medical needs that may be imminent or maybe anticipated in the future. It's about making the transaction as smooth as possible. It's about helping with the move. And so for all of that, it makes sense to have a plan. And like we've mentioned before, better to do that when there's not an imminent crisis. It's never too early to create a plan. Some people have me come in 5 years before they're thinking about selling to ask me, should I update the kitchen? I'm going to live here 5 more years. Does it make sense to put money into my kitchen? That's just an example. So I'm happy to come in at any point and do a complimentary consultation. And if a move is more imminent, I can actually give people a step-by-step plan for how do I transition out of the home within my timeline to meet my goals. So feel free to reach out if I can help at any stage in the home selling plan.
Thanks, Donna. That was
You're
really
welcome.
cool. Thanks. And next we're going to go to Alicia Mack, who is our Senior Living Advisor with Oasis.
Hey, everybody. Alicia here. So what is a senior living advisor, and why do I need to know what you are and what you offer? In this portion of the presentation, I hope to leave you with what I like to call some thought bombs, some thought-provoking questions to get you really stewing on, how does this fit with me, and where do I fit in, and why do I need to be thinking about this? How many people out there have experienced some concerns with an elderly loved one being at home alone? Maybe someone that you feel like could benefit from having some more support. Next, have you shared your concerns with this loved one? Let me ask you this, were you met with responses like, well, I don't need any help, or I'm just not ready to leave my home, or I can't afford it, it's too expensive? Denial of needs is very common with aging older adults. Do you think that if somebody has a denial of needs, that gets better as time goes by? In other words, if it's difficult for them to talk about it now, how is that going to improve as their need for support improves? Or excuse me, as their need for support grows, not improves. It doesn't improve usually. What's the worst that could happen from not furthering the conversation? A crisis, which is what we're here talking about today. Unfortunately, I'd say about 60% of the clients that I serve are in a crisis mode before they reach out. Their loved one had a fall or a change in condition like a stroke or a heart attack, and it landed them in the hospital or a rehab setting. And oftentimes the family's given, 3 days, 72 hours to come up with a solution. They may have their own things going on, and this can be really overwhelming to navigate all of the pieces that are involved with that. This is why our group here is so passionate about encouraging people to prepare themselves, gain some basic knowledge before they find themselves in that situation. So what's the best that could happen from continuing the conversation? Gaining education, like I said, on what care services offer what levels of support, just understanding how much it costs at the different levels, and what's the difference between the different types of care. When is assisted living not enough care? How do I know if my loved one needs a nursing home care? What's offered in an adult foster care setting? How does that differ from assisted living? What is residential care? And how does that differ from memory care? Do you even know all of the different types of care that are offered? Many people don't. Many people know or have maybe heard the term assisted living and a nursing home. There are so many other options, including support at home. So sometimes we just like to start off with some education on understanding what those types of care are. Approach matters. If you want to go to the next one, there you go. When adult children are perceived as trying to parent their parents, it often results in both parties feeling frustrated and unheard. I have met with several folks who, are trying to have these earlier conversations with their loved ones, but, the people are telling me about they were met with a denial of needs and resistance talking about mom or dad leaving home and going to a senior community feels like they're being forced to give up their independence. And many times just using the right approach and navigating these conversations with the loved one was all that was needed to further the discussion. If the senior is feeling like they're cornered or being told what to do by their children, if they have any confusion, memory loss, cognitive deficits, they'll likely shut down and not want to engage in further planning conversations. Families don't know what to do when their approach isn't working and when the senior's not listening to reason. They get frustrated and give up. When this happens, the senior and the family are essentially waiting for that next crisis to happen. This is too common, and I hope to get people thinking about not giving up on this conversation if they're met with resistance. There are folks like myself and our other speakers within the group who can help families navigate a plan and further the discussions before they find themselves in a crisis decision-making situation. Using the right approach is where I come in. I can help you with an approach that feels collaborative and doesn't leave the senior feeling like their children are telling them what they need to do. During my initial meetings with a new client, we talk about all of the different options for care, how people pay for it, and what kind of resources might be needed or important to the process. This is where we'll talk about other folks on our resource group, like realtors and power of attorney or estate planning folks, long-term care insurance questions, other senior services. Okay. And excuse me, if none of this is really resonating with you personally right now, perhaps it might just be that you're at work and or having a conversation with a friend and they're going through this with their loved ones. It's a great time to introduce the resource of a senior living advisor who can step in and help eliminate some of that overwhelming stress that goes along with this journey. Oasis Senior Advisors is licensed by the state to provide this service, which is completely free to all families, okay? There's no obligation, no contract to work with us. Just give us a call. Let's not wait for a crisis to keep the conversation going. Thank you so much.
Thanks, Alicia. That's really helpful. And you're not kidding about just the quick turnaround from having a stroke, being in the hospital, and then having to find care right away. They really only do have a few days. So reaching out to someone who, you know, works with over 900 facilities in the area and knows that area of expertise is a huge benefit to people. So lastly, we just want to talk about putting together your support team. And our goal is to help you do that before the crisis hits. So if you have somebody already in your life or you don't, we recommend you have a financial advisor, a tax advisor or state tax planner, a health insurance advisor, legal counsel, a long-term care and senior living advisor, and of course, a senior real estate specialist as well. So thank you so much for the opportunity to share with you guys today. We will be providing our contact information, and you can also join our Facebook group and share with your friends the resource group so we can help the community to understand these topics that are really important.
Thank you so much, Jackie. I will go ahead and stop the recording, and then we can have some questions. And I'll make sure to get the resource packet in the chat.